Ever wondered why some people can't sit still for more than a minute, or why they're always lost in their world? Welcome to the fascinating world of ADHD. Attention Deficit Hyperactivity Disorder, or ADHD, is a neurodevelopmental disorder that affects both children and adults. It's not just about being restless or having a short attention span. It is much more complex and intriguing than that. Contrary to popular belief, ADHD is not caused by poor parenting or a high-sugar diet. It is a biological disorder linked to differences in brain anatomy and function. People with ADHD experience a range of symptoms, from impulsivity to difficulty focusing, and these can significantly impact their daily lives. But here's the catch. Despite these challenges, many people with ADHD are also incredibly creative, enthusiastic, and energetic. So ADHD is not just about being hyperactive or inattentive. It's a complex disorder with a fascinating science behind it. But before we dive deeper, do you know what else requires your attention? Hitting that subscribe button. Imagine it's like your brain's focus button, but instead of making you zone in on a task, it brings you one step closer to becoming an ADHD whiz. Each click transports you into a world filled with enlightening information about ADHD. So what are you waiting for? Click away. Now that you've hit the subscribe button, let's get back to uncovering the mysteries of ADHD. So, what causes ADHD and why do people struggle with it? Attention Deficit Hyperactivity Disorder, or ADHD, is a complex condition influenced by a multitude of factors. Let's dive into some of the most common causes, starting with genetics. Yes, the apple doesn't fall far from the tree. Research suggests that ADHD tends to run in families, indicating that genes play a significant role. Next up, we have environmental factors. Exposure to certain toxins like lead during pregnancy or at a young age can affect brain development and contribute to ADHD. Even factors like premature birth and low birth weight have been linked to the condition. Now let's shift gears and look at the struggles faced by people with ADHD. Picture a day in the life of an individual with ADHD. They might grapple with inattention, finding it challenging to focus on tasks at hand, often jumping from one activity to another without completion. Hyperactivity is another common struggle. An unending surge of energy that can make sitting still feel like an impossible task. And then there's impulsivity. This can manifest in various ways, from impatience to blurting out inappropriate comments. But the most important thing to remember is that ADHD isn't a disorder of not knowing what to do. It's a disorder of not doing what you know. ADHD isn't just a label. It's a battle that many people fight every day. Now you must be wondering, is there a way to manage ADHD? Indeed there is. There are several treatments and remedies that can help manage ADHD symptoms, and they often work best when used together. Firstly, medication is a common treatment method. Stimulant and non-stimulant prescriptions can help balance chemicals in the brain that affect attention and behavior. It's akin to fine-tuning a radio to get the clearest signal. Secondly, therapy is also beneficial. Cognitive behavioral therapy can teach you how to manage your symptoms by changing your thought patterns and behaviors. Think of it as learning new ways to navigate your mental map. Lastly, lifestyle changes can make a difference. Regular exercise, a healthy diet, adequate sleep, and mindfulness techniques can all help improve focus and reduce impulsivity. It's like giving your brain the best possible environment to thrive in. Remember, it's always crucial to seek professional help when dealing with ADHD. And now for the moment you've all been waiting for, the end of the video. You know what they say, all good things must come to an end. But don't be a stranger. Comment, subscribe, and remember, you're not alone in this ADHD journey.